Hello, hello.
Good morning to all.
So we're just giving a few seconds. I think we had 9 participants signed up, but we have 3 thus far. So in the queue. So I think we're just waiting for the 3rd person to enter the room, and then we will begin. So I think just in the interest of time, we have 2 folks in the room and the rest of us, so we've outnumbered you. But we're happy that you're here. So my name is Angela Robertson, and I am the executive director at one of the community health centers, Parkdale Queen West Community Health Center, and part of the group, the Black Health Equity Working Group, who is kind of leading an effort that we'll share a bit more information about in this conversation to get your input. And given that we are a small group, the team of us 3 will introduce ourselves, and then we'll turn to you for some introductions. So maybe I turn over to you, Ryan.
Wonderful. Good morning. Good morning, everyone. Thank you so much for joining. So my name is Ryan Hines. I'm the community engagement lead and health equity at the Toronto Central LHIN. I also do some work supporting some outreach initiatives at the Ballana School of Public Health. And of course, part of this Black Health Equity Working Group. I'm just honored to always be working beside Angela and Sana, who I'm gonna toss it to right now. Thank you.
Hi, everyone. My name is Sana Dube. I am the Policy and Government Relations Lead at the Alliance for Healthier Communities, and I'm also a member of the Black Health Equity Working Group. And I'm based in Toronto right now. It's really lovely to meet all of you and looking forward to being in conversation with you this morning. Angela, I'll hand it back to you.
Yes, thank you. Thank you. And I'm going to now turn. I see Jin as a 3rd person who has joined. So Jin, part of what we've just done is introduced ourselves, and given that we're a small group, is going to ask yourselves as participants to just introduce yourself and maybe which organization you're connected to, and maybe a few words on what interests you on this particular topic and theme. So maybe beginning with yourself, Lily.
Hi, my name is Lily Lumsden, and I'm the Senior Regional Manager at the YMCA of Hamilton, Burlington, Brantford. My portfolio at the YMCA is I manage programs, employment programs in all 3 of our regions, as well as newcomer and immigrant services programs. And we have a number of programs that I call youth intervention programs. So specific programs that work with, we work with youth who are survivors of human trafficking, helping youth that are part of CAS, help them as they're aging out of care. So why I'm interested in this is we have a significant number of clients who are Black, and especially young Black people, and a high number of young Black males. And so the more that we can do and that I can do as a manager and as a person in terms of being able to help our clients and participants through whatever they're going through, and helping them, be wonderful people in their lives, knowing that, certain individuals have a harder time than others. And so I want to be able to do what I can to help everyone that we work with.
Thank you. Thank you. And may I turn over to ISAP? You're on mute.
You're unmuted.
Hi, my name is Rosemary, and sorry for misleading you. I signed in on a wrong account. My name is Rosemary Swani. I am the Settlement Services Manager at Immigrants Working Center in Hamilton, Ontario. Hi, Lily. So I've worked at Immigrants Working Center for 15 years. And for 14 of those years, I was working in employment as employment services. I recently joined the settlement team in a management role, and I do manage a team of 15 settlement service workers. We provide a full suite of settlement services in Hamilton. And my interest in this session is number one for the clients that we serve, and number two for myself.
Thank you very much. And I turn over, next person is Jean.
Sorry, did you say Jin?
Yes.
Okay, hi, I'll just turn my camera on briefly. Hi everyone, I'm Jin. I'm a program director at North York Community House. So we are a multi-service neighborhood center, and we serve the northwest part of Toronto. Most of the people that we work with are immigrants, refugees, Black residents, racialized residents living with poverty. And we're really interested in having, taking a new approach to how we collect data. And so we want greater data sovereignty. We want to be able to control the data that we have. And we also want to take a data equity and a community-centered data approach. So right now, like many others, we collect data and we mostly use it to report to funders. And unfortunately, and to some extent to shape our programming, but not as much as we would like, because we don't have actual full control over data, unfortunately, and we're not able to collect everything that we would like. And we, want to build some better practices about how we collect data with people who have mistrust with institutions and data collection. And so we want to do that thoughtfully. And then we want to be able to do data collection in a way that's with community and not about community alone. So definitely interested in strategizing and talking about what others have done as we go down this path of learning for ourselves and kind of reorient our strategy around the data equity and community-centered data approach. And I just apologize in advance. I have to leave early in this session, but I'm excited to participate while I can.
Okay, thank you. Thank you very much. And Irami, if I've pronounced that correctly.
Yes, you did. Hi,
okay,
everyone.
Lovely.
Hello, I'm Irmi Hatfles. I'm the Senior Manager of Language Skills and Social Development at Catholic Cross Cultural Services. We are a settlement agency working in the Scarborough, Toronto, and Peel region. I am interested in this workshop. We've been working in a data project for the past couple of years, looking at how we can make better use of the data that we collect, and to really support programs and to support the community so that it can really inform the work that we do in a way that is that's useful and accessible, and also grappling with how do we work with data in a way that that respects privacy, that respects the people that we are collecting the data from, and how do we make sure that because data is really, really important, right? And it's important to tell, to have data to be able to tell stories and to talk about impact and to talk about gaps and challenges and inequality. But how do we make sure that we use data properly?
Okay. Thank you very much. Thank you. And the other person is Jani.
Hi there. Thank you so much. Sorry, I jumped a little bit late.
That's okay.
But I'm hearing what others are saying. So I'm Jan Trinidad. I'm coming from West Neighborhood House. We're a multi-service organization that's been around since 1912. So we have a lot of different programs from children all the way to seniors. And we're located at downtown West Toronto. So we have various locations and yeah, we've been around for a long time. I think my reason for participating today is a lot already has been said, which is, you know, Jen raised some really good points, Irmi as well, sort of echoing my feelings. But I think as a multi-service organization, one of the things with data is that everyone seems to be collecting different data, and it's all from dictated by our different funders. So we're funded by all levels of government. We're funded by foundations and United Way and the City of Toronto, you name it. So I think we're sort of in a cookie cutter type of approach in the organization, and we are currently working towards implementing a common data system for the whole organization. But this is going to take us some time because programs are all so different and they're working with different populations as we are multi-service. So it's a challenging task, and we've started already a little bit with some programs, but it's going very slow. The other issue that comes to mind is, you know, I think with data for us is we want to show that we're actually doing an impact in the community. The work that we're doing, we're supposed to be working with the most vulnerable, and that's actually in our mission statement. We're working with the less disadvantaged or less advantaged folks in the community, and how do we know we're actually doing that? How do we know we're actually connecting and bridging and bringing people together and really helping the folks that are most vulnerable? We don't really know that at the end of the day because we don't have a common data system, or we don't have ways to collect information from folks. But like Irmi said, you know, regarding privacy, that also comes to mind. You know, privacy laws, you know, they tell us that we should only collect what we need. Well, what is it that we need? What kind of data do we need? And how do we know that? And so I think these are the questions that come up. And I think that my organization, West Neighborhood House, has been grappling for a long time, I think. And we continue to do so. Thank you.
Thank you very, very much. Thank you very, very much. So we have a very rich group in terms of range of organizations and locations, but I think all with a common interest around, one, the collection of the data, but most importantly, the utilization of the data to demonstrate impact, but as well, how do we hold that data in a way that is accountable to the communities whose data we're holding. And as in terms of was raised around in terms of data governance, data sovereignty, and as well, you know, starting back to Lily's point as well around how do we actually use the data to really lift and improve the lives and well-being of the communities of clients who are most on the margins, and particularly those clients who are racialized, who are facing a series of intersectional points of oppression, discrimination, marginalization. So we're hoping to have a very rich conversation, and welcome you to, as we go through the presentation, to use the chat as well, because we will come back to that. And Sane is here as somebody who is more tech savvy than the rest of us, but Ryan will show you from time to time that he too is tech savvy because he just got one of those rising desks. So so he's a bit of a show off about that. So you will see him moving up and down from time to time. So as I said, for those who came in later, my name is Angela Robertson, and Ryan and I will be sharing an initial presentation to just basically set a bit of a context. And then we have some questions that we have for you to really engage in a bit of a conversation and get some of your feedback and perspectives on this effort around data collection, particularly for Black communities. So I will turn it over to Ryan and we'll start the presentation, but certainly use the chat, and we're a small enough group that we can be nimble and respond in time.
Absolutely. Thank you so much, Angela. And as Angela mentioned, if the mood so strikes me, I might just lift my desk and stand and show that Not only am I digitally tech savvy, but I have a very tech savvy workspace, evidently. So I definitely want to thank everyone here. You know, before I started, I must say, I'm a former Hamilton resident. So whenever I see some folks from Hamilton, I also want to give a nice shout out. I used to live in Hamilton, so it's whenever I meet people, I have to just feel a sense of solidarity, I say. And so, as Angela mentioned, we're here to have a bit of a conversation, and we want to make sure we thank everyone for taking the time to turn on their camera, whether it's momentarily or whether we do that. And I encourage you to continue to do that. I find in this sort of era that we're in, these things help humanize the room a little bit as we miss some of that sort of interaction. So we do appreciate that, and thank you everyone for just even joining us today. And so Angela and I and Sane, as members of the Black Health Working Group, whom I might describe as a collection of individuals that are involved in sort of in health provision, health advocacy, health academia, and in the health system space. So we were pulled together to address some health equities that we both witness and experience. As members of that group, so we've come to you today again to have a bit of a conversation on a topic that we believe, and obviously, as everyone has just stated, you also believe is tremendously important to the health and lives of the people that we serve, Black and other racialized groups. Son, if we can jump to the next slide. So maybe we can just talk about our experience, and I think maybe some of our experience can help inform some of the work that you're doing. And so while it's a persistent focus for many of us, the topic of race and socio-demographic data collection reemerged to the forefront earlier this year when in the face of evidence that would prove otherwise, one of the lead health officials within our province indicated that the pandemic was an equal opportunist, if we say, and that affected all of us the same way, and that we did not need race and socio-demographic data collection as it pertained to COVID-19. And so standing before us was the quintessential example of why race and socio-demographic data collection was and is so crucial. It was clear that based on the perception of a uniform problem, that the public was going to receive a uniform solution, right? And while collecting data is generally good, and we know this, only collecting and analyzing only aggregated data is an incomplete approach, right? And further to that, only using this aggregated data in your response, whether it's a system response, whatever the case may be, is one that, and any sort of response that impacts lives is dangerous to do so. And we also know this. So sociodemographic data sociodemographic based data is a critical tool that we use in highlighting, I would say, the outcomes of social inequalities. And it's vital in our ability to recognize those problems, and those problems being the symptoms of systematic inequalities, and then begin to challenge those problems with a more appropriate and a disaggregated response, if you will. So it allows us to recognize that communities need additional and different supports that may fall outside of the uniform response. Then it allows us to understand if these strategies are working. I think we heard today that I think what some folks in the room are looking for is how do we understand if the data we're using and the solutions that we're applying are actually having or achieving the outcomes that we're searching for. And so I like this quote that I've heard, and I don't remember exactly where I've heard it, but when I heard it, it stuck with me, and maybe some of you have. The quote said that if they don't measure you, then they can't count you, and if they don't count you, then you don't count, right? And so it again reinforces why the disaggregated data collection is so critical. If we can advance the next slide, Sana. So what we're pushing towards and what the goal is a place where we can change the course of historically marginalized people and get to a place where instead of being left behind, we're recognized and prioritized, and where we feel or where we don't feel that, you know, that we're almost being punished for our situations and punished for being an essential worker and being punished for having to take the TTC to get to work or whatever our situation may be, because the solutions or the strategies that are being utilized don't address those and leave us behind. If you can go to the next slide, Sana. And so where we are now and really what is the issue? Public health units across the province have begun to collect race-based and sociodemographic data to understand how COVID has impacted our communities, which is great. But of course, as with any sort of knowledge that you gather or gain, having that knowledge is only as good as what you do with it, right? This issue arises when data is used to stigmatize communities that we're intending on prioritizing and serving. It's happened when data is used to create inaccurate narratives about communities or peoples, right? We see it when data is reported without stories or appropriate explanations and analysis to that data, and it's presented in a sort of vacuum where folks have to sort of do their own interpretation without the appropriate context. It's where data is reported about these communities without engaging those very communities in the analysis of the data and in the validation of that data and validation of what story that data is telling. When the data is held inaccessible to the communities and the very people who the data or who have given and agreed to provide that data and provide that information. It's seen when the data is collected and disseminated without proper governance that show respect to the appropriate communities, and it's seen when data is captured with little to no evidence of the use and the improvements in outcomes to the people that we're collecting this data on, right? And so the outcome we seek is not data collection, right? Data collection is a tool. And it's a very, very, very powerful tool, as we all know, and as we all know as well, that if you know if any of us ever get a powerful tool or any powerful tool that exists, those powerful tools need instructions, lest the tool is misused and end up causing more harm or damage. Like I think about if I've gone to Home Depot at some point and I gotten one of those major, let's say I'm trying to buff my floor or something like that, without the right instructions, I may not end up using the tool or accomplishing what I'm trying to do, and may end up very much damaging my floor. You know, so I would say that again, powerful tools need instructions, and data, and so race and sociodemographic data is no different. And so the EGAP framework that we're going to present and get into a little bit more is not it's not a detailed solution. Rather, it's an instruction booklet or a set of guidelines where that solution might lie, right? It's not the extremely detailed pieces, but it is the guidelines of how you may utilize and gather gather and utilize this data. But again, before we move on to the framework, maybe I'll pass it to Angela, who can maybe run us through some of the ways that data has been collected within the region and utilized within the region.
Yes. So thank you. And in terms of in the I think Rosemary in the chat noted coming to this conversation with a certain degree of pessimism and or mindfulness, because we know that data that has been collected and or how data has been used for and in racialized communities has, as you noted in your slide there, Ryan, I think your fourth point has been one where it's been more about surveillance and monitoring and containment rather than improvement in condition. So I just wanted to use a few minutes to just speak to from within, and this is a bit Toronto region experience, meaning the former Toronto Central LIN, and how some efforts that this region has used around some data collection and or some data collection that's happening in the Toronto space that I think can be instructive and or just examples of how data has been used currently. So just turning to the next slide, Sani. So Ryan spoke much and eloquently to the need for the data collection and why that is important. So, you know, in terms of just sharing this, and we can make the slides available to the participants after the session. But, you know, we know wherever you are in terms of diverse populations exist. And one of the things that sometimes we hear is, well, we don't need to do that because we don't have those people living where we are. And I'm always saying that sometimes the absence of people is in itself a finding. So it's not just about the presence, it's also about the absence. So in terms of when you look at this particular, in terms of map here that has been used in the Toronto region is from a healthcare lens, is that you see that there is a diverse in terms of patient population and that a number of the clients who we are concerned about in terms of Black, minoritized, racialized clients are individuals who live in regions of the city where there's also correlation of low income. So having the data, as Ryan stated in I think the second slide, is having data about who we are and what are some of the other elements of the variables that impacts our lives become important, because then it can tell a fuller story that can then also lead to a much more fulsome responsive strategy. So as Ryan mentioned, just the example of folks where right now we're seeing a significant hotspot with COVID in the Black Creek Rexdale neighborhood of the city. So it has a high population of Black and racialized folks. It has a high population of low income folks. It has a high population of folks who work outside of their living region. So that means that there's a high utilization of public transit. And what we have seen in those areas is a high positivity rate. And when you look at then what are the conditions that can enable folks to be safe is, you know, you see pictures of people on significantly crowded buses, for example, because they need to go to work, which means that they also run the risk of bringing COVID back into their communities, into their homes, and low income situations make it so that they do not have the ability in their households for the right physical distancing to maintain safety for themselves and families. Next slide. In terms of some of the spaces where data and equity data has been collected in this province, this is just a glimpse of spaces where that data is collected. So while in the immigrant settlement services, there are elements of data being collected, we also can, we don't need to reinvent the wheel solely. There are other spaces that we can look to around places where there have been efforts to move into this direction. So you have, in terms of CHCs within community health centers and with hospitals, back in 2012, it was mandated that hospitals should begin to do some health equity data collection, and I'll share later the 8 questions that CHCs and hospitals have been mandated to collect information on. Within community mental health and addiction services, there has been similar data collection efforts. We know that within United Way, there has been data collection, and that data collection United Way has largely focused around visible minority data collection and income. So much of the United Way's work has been around VisMin category, which aligns with in terms of the governments of Canada in terms of their demographic collection. Then we also see research studies that have been doing data collection. And we know most recently the Toronto Police Services, based on heavy push by communities and activism by communities against carding, is while there was a push against carding, there was also a pull for you need to collect data so we can see and tell you and have it be magnified, not just anecdotally what we experience as racialized people, that we are being targeted more in terms of carding, but that the data will actually validate that. So Toronto Police Services, as of January, since 2017 they have been doing, but as of January this year, they have initiated a race-based data collection strategy, and supported by a I think it's an equity committee that has been working with them. Now, I will reserve some of my own comments about what will and will not happen with Toronto Police Services and ways in which some of their resources needs to be shifted to different spaces that I think can be much more responsive to the needs of Black and Indigenous and racialized and low-income communities. But they have started this effort, and hence accountability becomes important for how they use the data. And then, as Ryan mentioned, that most recently and urgently, with the surfacing of COVID in our communities, is public health institutions have been collecting race-based data. And we in this Black Health Working Group, data working group, have been pushing and advocating for the collection of data, because one of the things that we knew would happen was that COVID would differentially and disproportionately impact Black, Indigenous, and low-income communities. But we would not have, what we knew that we did not have the mechanisms in the system to validate that. So we pushed, and the chief medical officer pivoted and shifted his position that this was now important. And as they did that, part of what we have also identified is that we now need to have accountability mechanisms lifted in to you're collecting the data, but then you need to have an action strategy. So for example, how you use the COVID data, positivity data, to show where positivity rates are high, and if positivity rates are high in certain neighborhoods where we racialized Black and racialized folks live, is then it needs to drive a strategy about how you bring resources differently to those populations. Next slide. So I had mentioned in terms of learning from what has happened before. So here are back in 2012, when the Toronto Central LIN advanced the sociodemographic data collection project. It wasn't exclusively race, sociodemographic data collection process. These are the 8 questions, mandatory questions that are asked in community health centers and that are asked within certain departments within hospitals. We feel that these 8 questions and or questions in a similar vein should be asked across the system so that we actually get fulsome data about who we serve, who we are not serving, and then we can do some analysis about how those populations are differentially accessing services and or having differential outcomes. These, if you go to the Mount Sinai Health Systems website under our health counts, I think it's our health counts, Ryan, is that you will find these questions, you will find a whole suite of tools that you can use within your organization to support lifting up some data collection efforts, but also support refining what are some of the questions that have been tested that can be used within your organization and or within your sector. Next slide. So back to the question I think that Rosemary posed earlier is, and that Ryan kind of referred to is, so as we as a group of Black folks and racialized folks talk about the importance of data collection, we are not oblivious to the fact and to the reality that as Black communities asking for this data to be collected is that it is a contested space, because we know that we're asking for this data to be collected within a structure where white supremacy still exists. Yeah. So, which means that we know the risk about how that data can be used and how data historically has been misused in Black and Indigenous communities. And these are just some examples. So while the Tuskegee experiment was in the US, it had ripple impact for Black peoples wherever we are. So the Tuskegee, and many of you would know the Tuskegee syphilis study that ran from 1932 to 1972. And it was a public health effort in the US, which tracked low-income African-American men to better understand the progression of syphilis in the community. And really, it was a sham. Yeah. It was a sham and it was a deception of communities, and it led to widespread transmission of syphilis within communities, within families, where there was death and continued suffering within families, and which led to sterilization, which led to breakup in families. And this was a public health effort. Yeah. We also know that women with disabilities, there have been studies where women with disabilities have been forced sterilized. We know that similar things have happened with Indigenous women in residential schools. And we know as well that here in Canada, that within the residential school setting is that there was significant experimentation that was being done on malnourished children in residential school settings, and that those experiences still resonate and hold true for communities and families, why there is justified leeriness about race-based data collection. And hence, when we talk about race-based data collection, we need to be always twinning that conversation with outcomes for change. It cannot just be about the collection of the data itself. And then, as I said, most recently, we know that police collecting race-based data collecting race-based data is that information has been used specifically about how do you increase surveillance in particular communities because there is quote unquote higher rates of crime. as opposed to higher disparities needing more social supports. That the issue has never been about social supports. The issue has been more about how do you keep others safe from this community of individuals. So just wanting to say that we recognize that. No, definitely, Sani, you can move to the next. So this therefore brings to us, I think, the ethical issues involved in collecting race-based data. So one is that we've identified that when race data is collected is that we need to understand the social determinants of health that are twinned with race and racism. So the language of race and racism must be twinned when we talk about race-based data collection, because the reason why we're collecting the race-based data in the first place is because racism exists and it manifests itself in differential access outcomes for racialized individuals. The other piece that I think we also know is that the ethics of how we use that data is that it must be used to improve health outcomes. It must be used to improve conditions, and that we must always be vigilant about ensuring that it is not used to further ascribe kind of discriminatory in terms of analysis about particular race and communities, and that in fact that we know that is what has happened. And we see that right now, even in this pandemic, where we have an American president who calls coronavirus the China virus. And we have seen these kinds of instances before. We remember SARS as well. We also know that we have, the TSAC in terms of sickle cell anemia, where it has been ascribed as the Jewish disease, the Black disease, and therefore some of how disease manifests itself in particular communities is we look solely at the biology, but we don't then look at the underpinnings around some of the other social determinants of health factors. So we always need to be mindful of how we ethically use and analyze the data that we collect, and hence why it is important that when we collect the data, that we also increase the capacities within our organization about how do we effectively analyze the data, because you need to analyze the data informed by individuals who come to the work with an understanding about race and racism. Because we will, many of us remember, what was his name? Western University. Oh, my wreckage, mind, it would slip me. But Western University, where we had a researcher who basically did research about the brain and the brain of Black folks. And he's ascribing, as a Canadian well-recognized academic, where he ascribed lower intelligence to Black peoples based on what he assessed to be the size of the brain. And many of us back then protested and went to Western in lots of buses and cars to protest. So we know that how race-based data has been used has not always been to the benefit of communities, and as well, not just data, but also Black folks and racialized folks in scientific experiments, and how that has also not been valuable to us, and how that has been misused. Next slide. So then, then in terms of why, so given all of that, why does this matter? So back to where Ryan started, is we believe that it matters now more than ever. It matters now more than ever in the context of anti-Black racism, in the context of anti-Indigenous racism, in the context of COVID and its unmasking of these, unmasking of what we knew and what we experience has been the differential and the historic experience of Black folks And therefore, we feel that the collection of this data needs to be done so that our experiences can move from one of anecdote to actually be rooted in the data, whereby we can also use this notion of evidence base to make real tangible changes and to drive tangible changes in action. And that even when the data, where data collection and movement has been slow, we know that there has not always been meaningful improvement for Black life, for Indigenous lives. So in this moment, we believe that as we collect data, that there must be an absolute twinning of data collection and action for change. That we cannot just do data collection as a science for just pure research, that it must be done in an effort that is an action for change. And we also know that we don't have the same response to data collection, and that, you know, it remains a contested. So in this conversation, it would be good to also have some of that perspective surface around where, you know, Angela, all of what you say is good and true, but, you know, I'm still skeptical. I'm still not sure. And if that is the case, is then what are the conditions that would need to be ameliorated and or addressed to bring us to a space where that data collection holds more true? So then I turn it over to Ryan now to lead us into some of the conversation that we want to have with you around this EGAP, the governance, engagement, governance, access, and protection framework.
Thank you, Angela. Sometimes if presenting or being around Angela while Angela presents, I forget that I'm presenting and just end up listening, and I go, yes, that's good, and just, you know, right. Forget. But there was one thing that you touched on, just around the impact of not engaging communities when we analyze this data and then communicate this data broadly, and then the danger of communicating out data that is not informed by the communities that it's speaking to, right? Because I think it is important whenever we collect data that we commit to being transparent with that data and bringing that back to communities, right? I think that's very important, and I think that's one of the things that we'll talk about within the framework. But not doing so, and maybe I'm just jumping the gun, but it's something that Angela mentioned, and that's also now it's in my head. Just the variety of impact that can have is tremendous. A bit of an anecdote. So part of some work I do is outreach within schools from marginalized communities, and we sort of teach a bit about life skills, success skills, but also introduce students to public health systems, and sort of try to create a bit of a pathway towards further education. And so we've talked to some of these students about you know, social determinants of health, impacts of COVID, why certain communities are seeing higher rates rather than others, and how people's lifestyles or what their roles in society are, and how that shifts their exposure to COVID-19, and then what that exposure might create in terms of outcomes, in terms of positivity rates, and et cetera, et cetera. And so these students understand that now, and students are in high school. They at one point came back to me and said, you know what we're hearing, and I think this was in the Thorncliffe area. They're saying, well, you know what we're hearing, that there's such high rates in Thorncliffe, and people within the communities started to believe the narrative that was being communicated about them as being just more prone to getting the disease, or more prone to it for reasons other than their actual circumstances that make them more exposed to it. So not only does it have the ability to change the perspectives of people that are outside of the community, but sometimes it actually changes the perspective of people within those communities, right? And some of the students were telling me that they were having to actually explain some of the changes and why certain communities had higher rates. So again, just wanted to pin and emphasize, you know, why it's so important to within any collection of data, engage communities so that we understand what that data is actually telling us. And so again, back to the EGAP framework. So again, this is a piece that will help shape the governance, accountability, and engagement and access and protection of this race and socio-demographic data. And again, it is not the end solution. It is sort of the framework around how you may want to frame your own solution in terms of how you capture, collect, report, and what are some of the guidelines that you use to implement this data collection, as we understand that we do need this data. And as Angela mentioned, of course, there's different perspectives. It is not a uniform thought that, yes, this is all well and good. There are some things, but I think here is a way that from our perspective that we can do this and accomplish the goal that we actually want to accomplish and not have some of the adverse effects. Next slide, please, Sunny. And so what I'm hoping we can do here, Angela, is just kind of go back and forth with a few of these. Maybe I'll start with the engagement. And so in my opinion, we see that insufficient engagement, as we just mentioned, at all levels becomes problematic. And I think the root of, or one of the issues around engagement is the lack of commitment to carve out the appropriate amount of time to do engagement properly, right? I think within, I know the health system, we are constantly pressed for time. So let's say, how do we do this and then put this out quickly? How do we do this and then respond quickly? And that is a fair sort of pressure. But there is such a danger as we just described. It's not something that we can just kind of quick slap a quick done stamp on because we've talked to one group or whatnot, right? Or we've engaged one or two individuals. So I would say it is something that we need to ensure that we emphasize the importance of engagement. I'll flip it to you, Angela, for governance. Are you still muted, Angela? Sorry.
That eternal comment, you're on mute. So in this, really, we have a discussion framework that is the EGAP. So Ryan spoke to engagement. The other important element of it, as folks mentioned in your introduction, is around governance, which is how do we own the data? How do we ensure that community and how it has some ownership, and how do we also ensure that when the information is used, the data is used, it doesn't lead to further stigmatization. And this is also twinned with inadequate analysis and interpretation of the data. So the analysis, do the researchers have the skills and awareness that can be used effectively to inform how the data is being used to create strategies for our communities. And then the next slide, Sane. So Ryan can speak to these two, and then we will move into the questions that we would love to hear from you on.
And make sure I'm not on mute. There we go. And so we will just kind of run through these quickly to get to our discussion points. So access. So if we've created this data and created these sort of collection of data sets, it's obviously very, very critical that we allow communities to access their own data. And I think historically, that's where some of the issues have been in terms of communities wanting to take a look at this data to move things themselves, but not being able to get this data, or having to jump through hoops, or having to pay to access their own data, which of course, as we understand, is problematic. And so ensuring that communities have access to this data would be critical. The next piece around protection. I think we have spoken to this as we've talked through today. just the history of it building a lack of trust within communities, and just the experience of this data being used against them and not for them. Why would we want to help and give you our data, right? And that's a completely understandable response. And so that does stem from a lack of transparency, and things we've seen at various different levels of government and really within communities. And so having a clear framework around how we protect this data, or how we protect communities who are giving their data is critical. So maybe now we can just jump to the next slide and get to some of our questions and discussions. I'll turn it back to you, Angela.
So I think I have seen in the chat comments and perspectives that I think resonate with some of the questions that we have. So really wanting to use some time in this part of this session to get some of your perspectives, your insight that can also inform our working groups thinking about this EGAP framework, and what are some of the important things that as we think about a process that is about engagement, governance, access, protection of data for Black racialized communities and racialized communities, is what are some of the important things we need to consider. So so we have some questions around engagement. So what are important issues or concerns that should be included in any framework concerning race-based socio-demographic data use? Are there components beyond the ones that we have identified as engagement, governance, access, and protection that you think is important? And what would you consider to be problematic, things that maybe we have not thought of, or things that you had expected to hear but didn't hear, or things from your experience that there needs to be mindfulness because as we push the government to collect race-based data and use race-based data, we also want to bring them a framework that says accountably, this is how you must use the data, and this is the process that you must be engaged with in community. So would love to open the floor and hear from you on maybe just the first set of questions there, Sani, maybe, the 1 to 3. So in any random way, Sani is doing some scribing for us as well. So to capture some of the notes that, some of the points that you've raised. Thank you.
I'll just stop share so that we can see each other's screens. I will put these questions in the chat so that people have a sense of what we're asking.
Okay, and I see Michelle, Selena, Brian, and Ella. I may not have the pronunciation correctly, and I'm sorry for that, have joined us. So, and Teresa as well. So welcome to the session. And if you, when you speak, if you can just reintroduce yourself or just say your name and the organization, just so if other folks know who's in the room.
I can go first.
Oh. Lovely. Thank you, Jen.
That was a really lovely presentation. Thank you for that. Sorry, somebody's knocking at my door. I think you covered it all. And the only things I have to say are, I think, in the details, and probably you didn't have time to share all the details. So there's a few pieces. I think there's so much work that has to go into this. And first of all, I think the health sector and the community health sector is far ahead than many of us in other community-based sectors. And so having these conversations across our different sectors is so critical, and for us to learn from you who have forged a path further along. In looking at what are all the system changes that need to happen and the organizational changes that need to happen to take this kind of approach, it's huge. And so I think the road obviously ahead is challenging. I think one of the pieces that we have been kind of landing on is that building community capacity around data competency and leadership in that realm is so critical. So we can't, because, you know, data science and anything related to data, you know, people's eyes glaze over as soon as you say data. You know, people have a hard time, many people who have, you know, lots of skills in other areas have a hard time digesting data and thinking about data or being interested in data. So how do we build interest to talk about these important pieces, and how do we build the skills and competencies amongst people who are really marginalized, amongst Black and racialized low-income folks, so that they are doing this work, that they aren't just being consulted, they're co-designing, they, you know, we're building up a system where they have the ability to be in decision-making positions. And I think, like, how do we build that in? Maybe that's outside of your scope, but, you know, maybe there's some connections that can be made in terms of system level changes and organizational changes to just like all the staff competency building that needs to happen, so that every person that comes through the door feels comfortable when you ask them about their sexual orientation. Most people don't want to tell that to a stranger. To be able to, as an organizational leader, to feel confident that every one of my staff can create a welcoming environment so that anyone asks that question gets the right response and the open, welcoming response they deserve. I don't have that confidence. How do we build that kind of confidence? That's a huge piece of change work that we all need to be a part of. So just responding to all the great pieces that you presented. Thank you.
So Angela, maybe I can start off and then you can knock it out of the park. I'll just tee it up for you. I think in the space of how do we sort of communicate that data to folks who like maybe the other 90% of the population who hear data and go, what? And glaze over. So in my role as a community engagement lead for the Toronto Central Inn, I think my job is communicating some of the more, I would say, back office pieces to folks within the community. And I find that what usually works is speaking less about the particular thing that we're talking about, which is, for example, if we're talking about data, I might not spend so much time talking about data until I talk about the impact of it, right? And I think I spend a lot more time speaking about the impact of data and really how it changes or how it could change their experience. And so once we've spent enough time talking through and talking about how their health experience or whatever experience, whether it's health or whether it's outside of health, how their experience might change, then I connect it to the tool to help change that, which in this case where we're talking about data. That's sort of a quick response from me. Maybe Angela.
So really at this point, I'm just going to be taking more of the feedback. So Jin, definitely hear you on the perspectives raised. Rosemary, I noted that in the chat, one of the comments that you noted is that and I hear it as a point of mindfulness and maybe asking you to speak a bit more to this, because how I'm hearing your comment is that as we do race-based data collection, is that the system could have a tendency to focus more on the data set, so the experience of just instantly being boxed in to, so if I check Black, if I check immigrant, is that the focus is the focus of the system may just be on those factors and not the totality of who I am. So maybe if you can just speak to that a bit more, because I'm hearing in that feedback some areas for mindfulness in terms of how we both collect and things that we need to watch out for. You're on mute.
I think the things to watch out for, to me, what I'm just looking for, the humane treatment of racialized communities who, my own experience has been that of being treated as a complex patient, chronic illness and forgetting that inequity itself and racism as well contribute so much to the poor outcomes of health, the same way as diabetes and hypertension will do. So just having that time, giving the time to listen and understand the circumstances of an individual, because we have so many factors that affect health. Understand the circumstances of an individual, map out that individual case before actually boxing that person and giving them the information about their ethnicity, their community, and such like issues. So that is what I have found a challenge with the healthcare system here. I will give an example where there is this client that comes and reports that my child has been diagnosed as bipolar, okay? And for instance, we know that bipolar is genetic. And there is nowhere in that family history where there is bipolar. There are rare conditions where somebody develops that later on their own, but taking the time to educate that parent about that condition, rather than just giving the instruction, this is what it is, and this is how we are going to proceed. That has been my perspective with healthcare.
Okay, thank you.
Another thing that I had wanted to ask is about this. I had wanted to ask this to Ryan. How, as in your work, how are you benchmarking progress in the data collection program that you are involved with now? How do you benchmark progress?
So maybe specifically within the LIN, we do have and ask our health service providers to sort of report on the data collection that they have been doing. But I think, to your point, that is someplace where we need to improve on is while folks are collecting data and reporting on data, how are we using data to sort of track changes and improvements? So what we're doing right now in terms of, maybe I'll use the COVID example, as we're continuing to track positivity rates, testing rates, et cetera, those kind of things within the communities. What our strategy is to, as we implement different strategies and supports within these specific communities, do those rates stay the same, right? If we have properly addressed some of the major concerns and some of the major issues around this, then those rates should decrease. Maybe I'm hoping that I've touched on that appropriately. Is that right?
Yeah, and maybe Ryan, I can speak to more as the so we're at the reporting end to people like Ryan. So so in the community health center world, I'll just use the example in terms of, as one of the benchmarking is around, say, cancer screening. So we know that cancer screening has lower rates by pulling the data. We know that there is a lower rate in terms of screening for immigrant, racialized, low-income people specifically. So part of the benchmarking is saying that if this is the provincial average of cancer screening rate, which is, I think, maybe about 68%, we know that communities who fit within that are sometimes within the 30 percentile in terms of screening rate. So part of our benchmarking is, okay, 68% is provincial. We want to engage in strategies to move this group of clients, immigrant women, racialized folks, low-income folks, into the 68 percentile category, which also means then that the outcome is that where there are cancers detected is that there is earlier detection, which then leads to greater likelihood for better health outcomes because there's earlier intervention. So that's just one of the examples in which we have used the data and the benchmark from the region to then improve care, both care access and care outcome. Now, because this has been a collection process since 2012, is we know that we needed to also engage in some, I call it a bit of a longitudinal study to really make sure that the health improvement outcomes that we desire has been achieved. So in this, back to this, not even back to, but in the context of this conversation about race-based data collection, is it cannot be a flash in the pan kind of process whereby governments and our processes and our organization run into it and run back out of it, because we know that you need to also look longitudinally to really make sure that the efforts that we're investing in now really produce improved outcomes in the near and longer term. So it is, so Sane has a question, but I also know that Lily, one of the pieces that I think it was Lily in the comment identified that one of the elements that we need to be explicit about in this EGAP framework is the piece of around accountability, and maybe how that is twinned somewhere in the governance and protection, but that it needs to be more explicit than it is currently. So definitely hear that, and we've heard that. That's a brilliant echo, because we've heard that from some other groups that we have engaged. Sani.
Yeah, no, so I just wanted to say, because as we track this, Rose, that the recommendation that you're making is that we need to have clearer recommendations around benchmarks for progress. Is that a good way to put that? Okay, and then Lily, if I'm understanding, you are asking for us to have clearer recommendations around accountability.
Yes.
Is that what you're saying?
Yes, I think that accountability needs to be explicit. And I think, whoever is doing the data collection, they need to be accountable to the people that they're collecting data from, be accountable to the communities. So I think and I wasn't sure if it was kind of embedded within governance or, but I think it does need its own thing.
Yes.
Say no, like if you're doing this, you're accountable to a lot of people and to a lot of communities that you're trying to help.
Definitely, definitely. Now, I know that Teresa and Brian and Michelle and Selena and Illa, I think, others who have joined later as well, if there are comments, having heard some of the presentation as you've come into the space, is if there are some comments that you have to share in relation to issues and concerns about the collection of race sociodemographic data. When we look at the EGAP framework, are there elements missing, and or are there experiences from your organization and your work that you think calls for mindfulness and or perspectives that you would share with us? No, that's okay. That's okay. That's okay. So, and maybe Sane, maybe flipping to the next set of questions. And Ryan, I'd maybe leave this piece to you to.
Sure, and so these would be maybe our final ones that we can help. We can hope spark some conversation. So are there aspects of this work that are unclear or that you would need further clarification on? Is there anything that we've touched on that needs to be expounded on a bit more? 5, does this framework pose any challenges to how your organizations collect, how organizations collects, analyzes, and utilizes demographic data? If yes, what are the points of tensions and how can we begin to collaborate and address these barriers? And so we have put forward, again, a set of guidelines, but does that conflict with something that, does anything within these sort of guidelines conflict with your organization and how it currently or is looking to do that? And what sort of supports can we put to make sure that you are enabled to do so? And are there any other sort of issues or questions that you'd like to raise that we haven't touched on yet? I know folks were looking for just any sort of feedback on maybe how they start their process. So if there's anything around those, we'd be happy to hear. So pause now for some more conversation. But I'm seeing right now some comments in the chat.
If I may say something, just a comment. I don't know. I work with the newcomers to Canada, and I don't know at what point the data gets collected, by whom, when, and how. But my experience has been that, for example, when collecting data from newcomers immediately upon arrival, sometimes when it comes to health data, it may not give a true picture of what the actual circumstances are of people just because of their background. Most coming from communities and cultures that that kind of either do not trust or do not trust authority or question authority or just bow down to authority. So if data is being collected at that stage, I wonder about the accuracy of the data that may be being collected at that time.
So from that, I'm really hearing where the data gets collected could have an implication for the completeness and or the accuracy of that data because of the individual's relationship with that particular site of authority, for example.
For example, yes.
Yes.
For example, if you come from a background where the doctor knows it all, okay, and then you are coming here and you come to a community like this one where you are expected to direct your own healthcare, and all information is given to you at a go and stuff like that. You may not be able to fully disclose or be able to know actually how to use that information that's been given to you at that particular time.
And I think where that's an important conversation, I think, for our working group to have, but also the system writ large to have, is about where should be, if we move to some centralized spaces where data gets collected. So if it's at OHIP for those people who are OHIP eligible, or some other spaces, where should be, what are the more appropriate spaces for where the information should be collected and by whom? Because that can skew the completeness of people's ability to respond and or their comfort with responding. So an important question, definitely. The who. And I noticed that also in the chat, there was a question around what are the questions that can be asked. And I think Ryan may have shared the link in the chat, the link to the Sinai Health Systems website, whereby you can, there's a magnitude of, since 2012, a wealth of information there that would welcome you to go to access in terms of the resources that are there. They have been developed with community and partnerships with community. So you have both there, you have questions, you have training tools about for the people who are in front of asking the questions, training kind of information about how best to ask the questions, and lots of Q&As that can be used for the clients as well, about explaining to clients, why are you asking for this information? So there's materials there that can be used, and it's open access. So there's no proprietary in terms of ownership of that material. So definitely would welcome folks to go there.
And in addition to videos that show an example of a certain experience or a certain sort of conversation and what that looks like. So there's a lot of resources out there, and resources for, again, different settings, acute, community, etc. So there's different settings, different tools, and I think the questions were developed some time ago. The questions are always going to continue to evolve as we learn more about communities and how to phrase things properly. But I think these are a great place to start, in addition to some of the points that we've discussed today.
Yeah. And for folks in organization that have identified that you are, so I know Lily spoke to this, but if there are where kind of folks are signaling, we want to do this work, but we are struggling with either how to start. We would love to learn from others who are doing. So maybe if others can speak to, if you are doing work, what are some of the strategies that you have used? Because others in this room may be able to tap your shoulder to draw on your experience, and we can certainly share after we hear from you some other spaces that you can draw on for support. But would love to hear from others in your organization. If you're contemplating this, what are the things that keep you up at night as you come to this this effort?
I'll start. Right now, in my programming, of course, because we're funded by the provincial and federal governments, we have sort of a list of data that we're supposed to collect. In both of the funding pots, it sticks to the visible minority question, which I don't like. It's not helpful. And then, although for Indigenous, it does get into a bit more detail around Métis, Inuit, and First Nations. But that's pretty much all that we collect. In our immigrant services programs, again, it asks, what country were you born in? But that doesn't really tell you much either. So we're thinking about, do we collect race-based data? But it would be separate from our funders. And if we do, what does it look like? What should we, how should we, and then all of those things around, what do we use it for? Now that we have it, what do we do with it? And making sure that, we're accountable, we're governing it properly, we're holding it properly. So I think we should. It's where do we start? Because the stuff that we have to collect for the government, for our funders, isn't good. And garbage in, garbage out, right?
Yes.
And that's why I was asking about the questions, because you can get whatever answer you want if you ask the questions in a certain way. So data and stats are great, but they can also, you can use them to put forward whatever evidence that you want. It's all in how you manipulate the data. So that's kind of my struggle.
Sorry, you've muted yourself, Angela, and then.
Sorry. Oh, yes. You know, I was on and then I turned myself deliberately off and then started speaking. So, Teresa, I see your screen is up, so I would turn to you.
I'm very hesitant to even open my mouth because I came late, I joined late, I was dealing with some stuff, but this is one topic that, yes, it keeps me off awake at night. The collection of data, particularly on the issue of race, particularly on these new developments with COVID and the whole ABR education that we have had to implement much more heavily at our office and for our own sake to understand it better as well. One of the things that keep me awake of collecting race data is, I'm going to be very basic and very, I don't know, maybe not making sense. You know, when you collect data by race, how you use it, yes, you say responsibility, accountability, all that, but you have boards of, not boards of education, how they call these clusters of people that make the decisions on what level of education the people have to have in this demographic, because in this point of the city, there is more of this demographic, whether it's Black or it's Latinos, and Latinos being the ones that in my heart, because I'm one. I didn't know when I came to Canada, but I found out that all the things that you know, that the level that they keep the education in the different places in the city, at the elementary school level, is lower in certain areas. Less race carpenters, less rate IT, but not science, no science and no lawyers and no doctors. But let's keep it that way, because anyway they are Blacks or anyway they are Latinos, and now we know where they are, and we know where they are in big bulk. So let's just keep them down, you know. And these are the things that keep me off from collecting. I remember the other one is racial profiling, right? And I think those were some of the issues that were debating when they dropped some of the collection in the census. I don't know, and that the civil liberties were concerned of. And you, as one of the leaders in health for all, particularly refugees, must know also that is a clue issue. Yes, you want to use it in a positive way, but is it really being used in a positive way? I mean, I don't see a lot of, yes, I saw a lot with the Crossroad clinics thing, with the whole movement of MEV, and you because you were there, and I got goosebumps with the role that you play at that time. Honestly, it was really very empowering. But still, there is still work to do. And if collecting the data is the answer, let's collect it. If let's be very careful, you that are in that position. Thank you, that's all, I'm sorry.
No apologies, no apologies. So thank you, Teresa. I think your comment really kind of anchors in our last 3 minutes or so, and the facilitators may tell us that it's only 2. The importance of this conversation, because on one hand, what you're saying is the importance of knowing where the sites of inequalities are, but at the same time and equally, it's ensuring that that knowledge isn't used to further deepen those sites of inequalities and or basically cut off those communities from equity and equitable access, but that in fact that information is used for exactly the purpose and the intention to improve access, improve outcomes, and improve quality of life conditions for marginalized and racialized community. So I think exactly that.
Opportunity, not to take the opportunity away, because here is all the Blacks, here is all the Latinos, let's just give them lower education.
Yes.
Keep them down.
Yes. Yes, and the comment, the other comment is that as we're doing sociodemographic data collection, is important not to forget language as one of the important variables that can lead to marginalizing. So if you're not French speaking, if you're not English speaking, is that it can have impact when twinned with race, with immigrant status, with other identities. So the folks are telling us that we need to wrap up, but really wanting to thank you. And Teresa is from Fred Victor Center, and Brian, I'm not sure where you're from.
I'm from the Canadian Center for Victims of Torture.
No, CCVT.
Yes.
CCVT. So Teresa from CCVT. Brian is Brian from I'm not sure where Brian is from, but if you can type in where you're from, Brian, Ila, and Selena in the chat, just so we know who we were in the room with. That would be brilliant. And I want to thank you deeply for participating in this conversation, Ryan and Sunny.
Again, just to echo everyone's sentiments of just how rich of a discussion this was, and appreciate everyone's just candor and just comments and feedback that we've gotten on our EGAP framework, but hoping that we were able to kind of provide something that you found helpful and useful and some points to take forward. And we definitely hear you. It is not, or we have not yet achieved where we're looking for. There's definitely some work to do in ensuring that the right restrictions around this is done, so that again, that the tool that we're giving, a very, very powerful tool, is not misused and abused, right? And so those are so very, very critical, and that's where some of these things can help with that. I'll toss that to Sunny.
Hey, thank you, everyone. I think the AV folks are like, get off this platform. So thank you very much, everyone. We appreciate your time. Have a good morning. Enjoy.
Good to see you all. Good to see you. Good to see you.
Bye-bye. Thank you.